Hello, this is Dr. Wells with Wells Medicine, and placebos are very interesting. So, in medicine, when you're doing a clinical trial, the sugar pill is called a placebo, and it is a non-functional sugar pill that you give to patients to be the control of the experiment. So there's an active experimental intervention, and then there's a control. And the control is supposed to be no intervention, basically. But what we find in medicine is that if you think you're getting an active intervention, you can actually get 20 to 30% of the results of the active intervention. So, for example, if you were doing a study on headaches and you had a control group that was given a sugar pill, and you had the active intervention group of people given the standard migraine medication, the placebo would actually have 20 to 30% of the response of the active intervention. And placebos can often also have side effects. So you can take a sugar pill, and just like the active intervention, people taking the sugar pill will often say, well, but I have a worsening headache, or I have a horrible stomachache, or my sex drive went down terribly while I was taking the sugar pill, or actually I developed even something like diarrhea, which you wouldn't expect from, a null condition, a non-intervention. There are sham therapies where you have people go and talk and it's not therapeutic, and they have results from the sham therapies. Sometimes we see results just from having people look at or consciously be aware of the study criteria. So, for example, in a study on dietary interventions, one of the things that they need to control for is, even when you ask people just to be aware of what they're eating, similar to cognitive behavioral therapy, where we ask people to be aware of their thoughts, just the act of looking at and being aware of something changes, in fact, what people eat or what people think. So even the intervention of just being aware of or writing down our thoughts or what we're eating can actually be more of an active process in an experiment than a typical sham or a control. Similarly, there's an opposite effect called a nocebo, where you give someone the active intervention, but you tell them that it won't work anyway. So, for example, if we go back to the headache study, you give people the active migraine medicine and you say, oh, well, but this is the placebo. This is just a sugar pill. It won't work anyway. And you actually see quite a large decrease in effectiveness by telling people that the intervention that you're giving won't work anyway. And where I think this really comes into play with our interventional treatments at Wells Medicine is sometimes the patients themselves need to believe in the treatment, and their family members around them need to believe in the efficacy of the treatment as well. So I'll hear a lot of patients who are saying, well, I know this won't work anyway. Nothing has ever worked. This won't work either. Or their family members will be very skeptical of the treatment. And I think it's so important to come in with at least neutral hope for the efficacy of the treatment, rather than carrying all of our past experiences, past failures, or treatment disappointments into a new treatment, because that expectation of whether something's going to work or whether something isn't going to work can actually be very, very strong. And it's a really effective way of not tricking ourselves into having more of an effect, but having all of the effect that's available to us by using words and using beliefs and hope, really, to get as much effect as we can from the new intervention that we're trying, whether it's TMS, whether it's stellate ganglion, whether it's ketamine. Going into it with a fresh attitude and forgetting about past disappointments allows you to really be open to all of the possibility of the effectiveness of the treatment.